Hi there, my name is Alex Kirby. I'm a psychologist. I'm also the executive director of Montford Hall, and this is the second in our video series on substance abuse in the adolescent brain. In the first video, we talked about a definition of disease that is an organ that gets a defect that manifests in symptoms. In this video, we're going to talk about what those symptoms are when the organ in question is the brain. So when the brain gets a defect, what are the symptoms that we're going to see? And I'm emphasizing this because one of the hardest parts about understanding the disease of addiction is that the symptoms are behavioral. So we're spending time talking about behavior. What are some examples that may be familiar to you? If you know somebody who's had a stroke, if you know somebody who has Alzheimer's, you may be familiar with some behavioral symptoms that are can be very frustrating. The person can be leaving things around the house. The person can not be able to dress themselves. The person can get lost in their own house or in the neighborhood and just get up and walk out. It can be very frustrating and affect your life in a very immediate way. And yet those are the symptoms of the brain disease that this person has. So that's an important distinction, that the symptoms when the brain becomes injured primarily are behavioral. Now there can be mood and there can be personality changes, but what we're going to talk about is behavior. Another example, well, let's talk specifically about addiction. Well, what are the symptoms when the disease of addiction becomes active? What are you likely to see, or what have you already seen if you know somebody who has the disease of addiction? Well, they can be very, very ugly. They will steal from you. They may prostitute themselves. They engage in all kinds of felonious behavior to get the drug or to not get caught from doing the drug. Lots of antisocial behavior, and they do it to people they love and care about. That's one of the things that obviously makes it so difficult. It doesn't make the behavior any more right, but they tend to do it to people that they care about because those people are closest to them and very often are trying to help them. So in any case, they may steal from the person they care about. They have worked with a client who stole jewelry from his mother. I've worked with clients who've stolen money from the piggy banks of their younger siblings who've worked to save money to buy a toy that they wanted. Really emotionally painful, awful behavior. And yet the important thing to keep in mind is, and one of the strong supporters for why those are symptoms of the disease once it's active, is those behaviors didn't exist before the person's use began and the disease process became active. And those behaviors go away when the disease is effectively treated. It only occurs when the disease process is active. And so with good treatment, no awful behavior. Prior to the disease, no awful behavior. During the period in which that disease process is active, all kinds of awful behavior. And so that's something to keep in mind, is that those are the symptoms that of the disease of addiction, and they're also the symptoms that for many, many people confuse the question or make the question for them harder to answer, is it a disease at all? Because so much of what they do is behavior, and whenever there's behavior, you assume that the person could choose not to do it, when in fact that's not really the case at all. And we'll discuss in future installments of these videos what actual brain mechanisms are involved in producing that awful behavior, and what brain mechanisms need to be restored to ensure that behavior doesn't continue. And I hope you'll join us for those.